Welcome back and welcome to our Community Corner. February is Heart Month, so all month long during our Medical Minute, we'll have guests from OSF here to talk with us about congenital heart care. And joining us this morning is Dr. Mark Plunkett. He's the Medical Director of Pediatric and Congenital Cardiovascular Surgery at OSF Healthcare Children's Hospital of Illinois. Good morning, Dr. Plunkett.
Good morning.
Thank you for coming in this morning.
Well, thank you for the invitation.
Of course. So we're talking about the Congenital Heart Center, which is a vital asset for Central Illinois. Tell us about the types of surgeries that take place there and how it is set apart from other.
Yeah, well, first of all, congenital heart defects are the most common birth defects and occur 1 in 100 live births, so maybe more prevalent than people realize. Now, not all these children will need heart surgery, but about 1 in 4 are going to need some sort of a surgical intervention or maybe a catheter-based intervention, and oftentimes these will have to be performed within the first days or weeks of the child being born in order for them to survive. Now, when we talk about congenital heart disease, it's quite a broad spectrum. Right. There are many heart defects, and even within the described defects, there's a lot of variation, anatomic variation and such. So when we talk about surgical repair of heart defects, we're talking about quite a variety of surgical procedures, because that may be as simple as patching a hole inside the heart, or it may be something as complex as restructuring or rebuilding the heart for some of the more severe malformations. Wow. Here at the Congenital Heart Center at OSF Children's Hospital of Illinois, we offer the full spectrum of surgical and interventional procedures for these babies that are born with heart defects.
Wow, wow. And I know that collaboration is key, right? Whether that's with a cardiologist or an interventional cardiologist. Does that always, so that doesn't always mean open heart surgery, right? That means different.
Right,
it could mean anything.
right.
It could mean different
Sure.
things.
Many of these babies can be managed medically and don't need either intervention in the cath lab or with surgery. But more and more we're able to do some of these procedures in the cath lab. In fact, there are a number of operations we used to do as open heart surgery that are now performed in a less invasive manner in the cath lab with great success. So it's a collaborative effort to decide which therapy a child will get and which intervention is appropriate for that child.
Very nice, very nice. And what about pre- and post-surgical care?
Yeah, well, the care of these babies is a team effort, a multidisciplinary team effort, and begins quite early, because the vast majority of these are diagnosed in utero with prenatal ultrasound. So we know these babies are going to have these defects. So we start working very closely with the maternal fetal medicine doctors, the neonatologist, obviously our cardiologists are involved, and a host of people right to the point of the babies being born. Once we take them to the operating room, we have another specialized team which involves anesthesiology, perfusionists, nurses, and surgical assistants to help us successfully perform the operations. And then once they go to the intensive care unit, it's again a very extensive team of people that involves the nurses, the advanced practice providers, the pediatric critical care doctors, we have pharmacists, we have respiratory therapists, and many others. And not only do we have an extensive team, but that team has to be in place round the clock to take care of these babies and to ensure the absolute best outcome from their care.
Well, that is wonderful. That is wonderful what you all are doing, and I know a lot of families out there appreciate having this, having the Congenital Heart Center here in Central Illinois.
Thank you.
Absolutely. Well, thank you so much for coming in, Dr. Plunkett.
Thank you.
Of course. Come back anytime. And of course, if you or someone you know would like to join our Community Corner, you can head to our website, 25newsnow.com. Go ahead and click on the Community Corner tab and submit the form there on the right-hand side of the page. And we'll take a look at it, and we hope to have you on. Stick with us. We'll be right back with more good news and weather.